Dokotela, who, WHO has isolated the Hantavirus to be the one that's circulating here in South Africa. Yo, Dokotela, it has person-to-person transmission. All right, stop taking me, guys. Let's talk about the Hantavirus in a clear and simple way for the last time. So, the Hantavirus is found mainly in Chile and Argentina. That's in South America, like we have explained. So, it lives in a specific wild type of rat or mice, native to those regions. People typically become infected by breathing in airborne particles from environments contaminated with the urine of these rats, the droppings of these rats, also the saliva of these rats, especially when you are cleaning or sweeping or moving stuff, they become, it's invisible particles that are just there in the air. So unlike most hantaviruses, the Hantavirus can also spread from person to person. How? Through close, prolonged contact, right? Such as kissing, studies have shown deep kissing, sexual contact, or sharing a bed, you understand, with someone who's infected. So importantly, there is a small but also definitive risk for healthcare professionals like moi. Transmission can occur through extended contact with patients, their bodily fluids, or even contaminated materials like their bedding or gowns. When I was reading a study there was one who was busy kissing the patient. We know most these people there in South America, the way they kiss. Mwah, mwah. So because of this, strict infection control is vital. This requires the use of physical protective barriers like your N95 mask, gloves, gowns, and eye protection to prevent the virus from making contact with the skin, the eyes, and the lungs. You understand? So these barriers are especially important during medical procedures that might create aerosols. If you're a medical person, you'll understand what I'm trying to say. Like suctioning there, or when you are busy intubating the patient, right? So this is for my healthcare workers there. So early symptoms resemble the flu, right? You have a fever there, muscle aches, and some stomach pain there, right? So while some symptoms usually appear within 12 to 27 days, anyone exposed must be monitored for the full 42-day incubation period, right? So the virus can quickly progress to what we call the Hantavirus pulmonary syndrome, or HPS, right? It's a severe lung illness, very serious and very mortal. So there's no specific antiviral treatment for it, right? So care is supportive. The body's immune system must clear the virus, while hospitals provide oxygen or advanced respiratory support. You understand? So prevention remains the most important tool. This means avoiding rodent-contaminated environments in, the endemic areas, especially if you are traveling around there, to South America and stuff like that. And using strict hygiene, my people, because the virus has what we call a fatty outer layer, right? So it is easily destroyed by disinfectants, even though it's encapsulated. So frequent use of alcohol-based hand sanitizers and disinfecting potentially contaminated surfaces with the alcohol-based solutions are essential to stopping the virus to spread. You understand? So get those hand sanitizers if you are afraid. You understand? Get the mask if you are afraid of someone's droplets, might be contaminated to contaminate you and all of that. Do you understand, my people? Just hygiene.